Good morning, honorable speaker, guests, ladies and gentlemen. Welcome to the ITTP COVID-19 webinar series 9 on the management of future healthcare and wellness center. Ladies and gentlemen, we have 5 minutes before we start. I would like to kindly remind everyone to fill up your attendance by answering the survey through the link provided in the chat box. Here are some codes of conduct that will be followed by the webinar attendees. Only registered participants can participate in this webinar. Those who haven't registered need to do so by filling up the survey form through the provided link. Format name in the Zoom as follows: institution's name, underscore title, underscore first name. For example, UTM, underscore Miss, underscore Alia. Participants are entitled to a certificate if the survey has been answered. Virtual certificate will be given to the entitled participant no later than 7 working days after the webinar is completed. Please use the virtual background set by the committee. Please disable the microphone when the speakers are delivering the speech. Questions can be asked in the chat menu in the Zoom with the arrangements, your name, underscore the questions. Only selected questions will be asked during the live sessions. Unanswered questions in the live Q&A session will be answered on the webinar's website. The speaker's materials will be set in the ITTP COVID-19 webinar website. All of the attendees are required to fill up the online survey. The links are provided in the chat box. Thank you. Honorable guests, ladies and gentlemen, welcome to the ITTP COVID-19 webinar series 9 on the management of future healthcare and wellness center. My name is Amiruddin, your master of ceremony for today's event. On the behalf of the host, I extend our most tremendous appreciation to each and every one of you for being able to attend this event. Honorable guests, ladies and gentlemen, ITTP COVID-19 is proudly present to you our 9 webinar series titled Management of Future Healthcare and Wellness Center. This webinar aims to provide knowledge on the transformation of healthcare and wellness centers in the era of COVID-19 endemic and Industrial Revolution 4.0. Participants in the webinar are also invited to join ASEAN Network of Healthcare and Wellness Center through the ITTP COVID-19 platform, where we can voice our ideas and suggestions on future healthcare and wellness. This webinar hosted by the University Technology Malaysia, supported by the Ministry of Health Malaysia, Institut Jantung Negara Malaysia, Indonesia Spa Association, other government agencies, and industries. Here is the rundown for today's event. We will begin this webinar with the first speaker, Dr. Fazila Saik Alauddin, followed by the second speaker, Dr. Suhaini Kadiman, and our third speakers, Ms. Ani Safitri, and our last speaker, Professor Dr. Iko Supriyanto. Each speaker will deliver the topic for 20 minutes, followed by 10 minutes Q&A sessions during each of the speaker sessions. Participants can ask the question either through the Zoom chat or raise up their hand. To wrap up the webinar session, there will be a photo sessions, so please make sure you turn on your camera, use the virtual background provided by the Secretariat during these sessions. Your Excellencies, distinguished speakers, ladies and gentlemen. For the next agenda, we will now hear presentation speech from our first speaker, Dr. Fazila Saik Alauddin. Before we start, I would like to read Dr. Fazila's short biography. Dr. Fazila is presently the Senior Deputy Director of the Planning Division in the Ministry of Health Malaysia. Dr. Fazila holds an MD from the National University of Malaysia and an MBA in Healthcare Administration from the University of Toledo, Ohio. Over the decade, she has been leading digital health and innovation strategies and collaboration both locally and internationally. She often represents Malaysia at regional and global platforms in digital health, including ASEAN and WHO. She is also an active board member of the Asia eHealth Information Network. Dr. Fazila will deliver a topic on the policy and regulatory framework in Malaysia digital health and innovation. Doctor, you will be given a 20 minutes presentation and 10 minutes Q&A. Questions can be asked in the chat menu in the Zoom or by raising a hand in the Zoom features. Without any further ado, I would like to pass this floor to our first speaker, Dr. Fazila Saik Alauddin. Dr. Fazila, the floor is yours.
Thank you. Can you hear me?
Yes, Doctor. It's clear.
Okay, thank you, Ahmed. Thank you for the kind introduction. Assalamualaikum and a very good morning. Someone is controlling my slide, yeah? Okay. So my name is Fazila Sheikh Alauddin. I'm from the Planning Division of the Ministry of Health, and a lot of my work is in policy and regulation and also strategy and project management. So today I'm going to talk to you about some of the policy and regulatory framework. And I think this is very important if we are planning wellness or health centers, and also what are the future that we can include when we are talking about digital transformation. So next slide, please. I think someone is controlling my slide. Can you enter? Okay. Just an overall about Malaysia, because I'm assuming there are also some from Indonesia on this panel today. We have a total population of 32 million, a much smaller country, and our population above 65 is 7.4%. This is a very important number. So by 2030, we are expected to be an aging nation. And health and wellness center is very important when we are talking about an aging nation. Our total health expenditure as a percentage of GDP is still very low, 4.7%. It is about 45-55 private and public. And the life expectancy over the years has improved to 74.9. So people are living longer, and that has a higher burden on the health sector, and with the increase of chronic diseases. Next slide, please. Next. These are some of the areas of concern in health, but I'm not going to go through it. But I think it's very important to know about disease burden, aging society, and mental health. I mean, we address all these areas of concern, which also includes the people issues, the delivery system, and also financing. Next slide. Next slide. These are some of the health and wellness data. If you see, our population is living longer, but the disease burden is very high. We have about 1.7 million people who have 3 major risk factors, mainly diabetes, hypertension, and also high cholesterol, and also very high number of people with double disease. So disease burden is very high. And if you look into some of the health and wellness data here, there's a lot of difficulty in seeing, hearing, walking, self-care, and also in difficulty in communicating. Depression is rising, and mental health is also another big agenda, and obesity, and also all the diseases, especially infectious diseases, and also diseases like TB. And if you see, the 10 principal causes of death is also up here. So there are a lot of issues to be tackled in moving forward for the next 10 years for the country. Next slide. And of course, the pandemic has actually affected us. We have about more than 249 million cases, and Malaysia has more than 2.5 million cases. It's not only a public health crisis, but a huge economic, social impact with the negative growth on the economic. And it has really exposed and exacerbated all the inequalities, disparities, and so forth. So moving forward in facing the new normal is very important post-pandemic. Next slide, please. Oh, this is, can you see there are things missing on this slide? Can you see the slide?
Yes, but still missing. I think better, Dr. Fazilah, to share your screen yourself.
I think, can I share my slide? Can you go out from here? Let me share my screen. Can you allow me to share my screen, please? Okay, sorry, I will share my screen. Just 1 minute. Can you see it now?
Yes.
Yes, Doctor.
Okay, now better.
Yeah.
Okay, so in terms of this, what I've done is I'm giving you a Malaysia digital health ecosystem as an overall. If you see, there are a lot of national and global commitment. This is a very important slide for you to know what's happening in the country. And then in terms of the national common infrastructure, but the national commitment is very important policy documents, yeah. And then in terms of governance and policies, we have a lot of strategic plan at the level of Ministry of Health, and also for standards and interoperability, and also collaborative platform. Ministry of Health cannot do digital health by itself. We have to work with people. So moving forward, collaborative platform is way to go. But some of the important strategies are here in this slide, where shows you a digital policy landscape in relation and how they are related to health. For example, in the 12th Malaysia Plan, in the My Digital Blueprint, in the public sector plan, these are all outside Ministry of Health, which has a high impact on the health sector. The National Technology and Innovation Sandbox, and also the 1010 My Science Technology Innovation Science Technology Framework. So these are some of the latest policy that came out, and all are riding on the shared prosperity of Vision 2030. So a lot of the initiatives when related to digital health, digital innovation are part of these policies, and Ministry of Health and also health sectors are heavily involved in this policy. But whatever we do, whether it's a 5-year plan, 10-year plan, and our short-term plan, all goes back to the shared prosperity vision of the 2030, where we are committed to achieve a fair and a sustainable nation. Some of our visions and goals and strategic direction it goes way back to 1997, where we had the telemedicine blueprint, where Malaysia is to be a nation of healthy individuals. It's a very relevant document even today after many, many years, because it talks about the vision of a integrated care. And so the whole vision is translated into the 5-year plan, which is the 11th Malaysia Plan. And today we already have the 12th Malaysia Plan. And we also have many strategic and digitalization plan. But what's important is the latest 12th Malaysia Plan that was presented on the 27th of September in the Parliament, which talks about enhancing health service delivery and improving wellness of the rakyat, and also revitalizing the healthcare system. So there are a lot of strategies in here. And if you look into the strategy B3, is talking about leveraging technologies. So the 12th Malaysia Plan itself has already given the mandate for digital health. And not forgetting the digital economy blueprint, there are also 6 clusters: economic, digital talent, and so forth. And health sector is very much involved in cluster 4 and cluster 5, and of course cluster 6. Where we have a lot of initiative for the next few years in bringing a digital trajectory to the country. This is the Malaysia's digital economy landscape. It talks about connectivity. We are very well connected, even though there are some digital divide in the rural areas. There's a lot of activities, e-commerce and digitalization in business, and a lot of it has picked up during the pandemic for the last 2 years. What we saw for the last 2 years is what we have never seen for the last 20 years. So it's just a very steep trajectory into the digital economy. Ministry of Health Strategic Plan 2021-2025 is also aligned to all the plans and policies out there. But what's important is we are number 4, where we are leveraging technology and innovation in healthcare. And part of it is also to improve research and development and innovation capacity within the health ecosystem, and also to digitalize the healthcare service. So what we have done is, from the strategic plan, we came up with our digitalization strategic plan. This will only be launched in December this year. We're already in the final stage of finalizing it. But a lot of the focus is on governance, on integrated health service delivery, especially public-private, public academic, and so forth. And also talks about the IR 4.0, a big data analytics ecosystem. The world is moving towards data-driven, and digital collaboration is very important. Competency, skills, and expertise, R&D, and also commercialization. But let's stop for a while and look at the reality check. What about science and technology is really rapidly developing, and we are already going into digital disruption. We cannot stop it, but how are we adapting to it? Consumer behaviors have changed, shifting dramatically, especially our patients and so forth. They are more empowered, more knowledgeable. They want on-demand retail-like service. They want hospital to be like Grab and Lazada. So are we able to catch up? What about new care models? We really need to modernize our policies and regulations, and we really have to have new models of care and reimbursement. And of course, the pandemic has given a lot of digital disruption. Our society has become a digital society and consumers over the last 1 year. So we really need to have high quality and timely data, and that has been really proven in this pandemic. So where are we today? So this gives you, the blue box gives you an overall where we are today. We have a lot of systems. We are going to do a nationwide EMR project, which I will explain later. We have big data analytics. There's a lot of e-government systems, online health services, which is a direct to consumer. There's also advancements in emerging technology in 5G. There's an entire COVID-19 digital ecosystem and solutions. But in terms of challenges, it is still silo, it's still fragmented. Our analytic capability is still very weak, especially in the health sector, in the public sector. Majority of our MOH hospitals and clinics are still manual. There's only about 30 to 35% hospitals with systems. Clinic is about only 10 to 15%. We still have public and private sector as two separate entities. And a lot of regulatory roadblocks, public expectation is high, especially in this pandemic. We are very slow in scaling and rolling out, and also the issue of sustainability of pandemic digital solution. Since we are also talking about COVID, I also focus a lot on COVID. In 2018, actually, we did this focus area for our future healthcare, but this focus area has become a reality in pandemic just overnight for the last 1 year. We are talking about healthcare back to communities. We are talking about innovation, partnerships, and public-private integration, which we saw in the last 2 years. If you look into all the digital initiatives that we did in the COVID-19, it's amazing what you can do in 1 year, which you could not achieve in the last 10 years. And the one in rates are the ones, some of the new system that has been done. And this cannot be done just by Ministry of Health. This has a lot of collaborations with academia, with the private sector, and also with the civil society. So these are the 8 areas. Some are new systems, especially the rate ones, but some are existing systems which we are using for the COVID. These are some of the major initiatives in the pandemic. We have the entire digital ecosystem for the national vaccination program, the multiple systems, about 8 or 9 different stakeholders which are involved to run the national vaccination program. Of course, MySejahtera app, everybody knows about it. It's more than 30 million registered users. And this is the main app, which is right now empowering the community. There's also an e-COVID-19, which is more of a data collection, reporting, and case management app, and also the hospital system for planning and operations for the COVID. But what's interesting is suddenly for the last 2 years, we have realized how important is data. So we have become a data-driven ecosystem, and these are all the dashboards that's available today for the pandemic, and showing different kind of data, and also the use of this data. So our vision is to become an interoperable health ecosystem, both public and private. And to achieve this, we must make sure all our health facility is ICT enabled, have some form of hospital information system or a clinic information system for us to achieve an integrated national health information system. So we have embarked on a national EMR initiative where we will include nationwide EMR implementation in our MOH hospitals and clinics, but connected to everyone to a health information exchange platform and a lifetime health record. So in moving forward, the future health and wellness centers must have goals of make sure there's continuity of care. There must be clinical, operational, and financial efficiency. You must improve quality and health outcomes, and to have data-driven insights and better patient customer experience. So we are hoping this national EMR initiative will have an integrated healthcare delivery towards a healthy Malaysia. But a lot of our projects has a lot of challenges in terms of policies, infrastructure, system, financial, and people. And these are the challenges that is everywhere is almost the same, be it in the public sector, private sector, Malaysia, and also globally. But what are the game changers for tomorrow? These are some of the game changers for tomorrow. So whatever facility or healthcare service we are thinking, all these game changers must come into play. Mobile devices, everything has to go mobile first. 5G, IoT, big data, cloud. A lot of robotics is now used in our centers, and also, of course, AI. But not forgetting, we must upgrade all our connectivity, and broadband connectivity now is a utility, which is a very good news. So we must not leave no one behind in this industrial revolution 4.0. But as I mentioned to you earlier, there are challenges, but these are some of the new challenges, a lot of legal, ethical, and safety. And I think more and more Malaysia must come up with policies that addresses this in terms of data ethics, privacy and confidentiality, issues on data governance, issues on data use partnership and sharing, and how are we going to do life cycle monitoring, for example, AI and IoT? What about cloud policy and governance? What are the new business models that can be done, not the traditional way? And what about platform governance and accountability? There's a lot of online health service provider which is direct to consumers. So who is accountable? What about our digital upskilling and future of work of our doctors, our nurses, our allied health? And what about digital literacy, digital divide and equity? Who is looking into that? So these are some of the new challenges as the country moves towards digital economy. So I think government, when I'm talking about government, it's not only Ministry of Health. Government has a role in digital health and innovation in the aspects of leadership, policy and regulation, access, talent development, and collaboration. And a lot of issues are mainly on policy, regulation, and legislation. We must ensure there are foresight policies. We must look into speed and agility in whatever we do. We must set the standards and interoperability, and also not forgetting the IP protection and regulation. And I think these are some of the role of government that can be done. So moving forward, I think post-pandemic, we really need a comprehensive recovery plan. The country really needs to be revitalized. Healthcare system needs to be revitalized, redesigned to meet the new needs. We also really have to further strengthen our health system preparedness and towards a resilient nation. I think adopting health in all policies is very important, and the pandemic has actually proven that health is not all about health sector. It involves all sectors. So all sectors must include health in their policies. We must enhance digital technology. We must enhance data analytics, and every sector must become an insight-driven organization. So these are some of the approaches which I'm recommending, new approaches in the digital economy era, which includes integration, nationwide scale-ups, cloud deployment model. It has to be cloud first, mobile first. We have to talk about new funding in sustaining digital technology. We need to talk about agile procurement and project management. We cannot continue to do work as we have done before. Public-private partnership is very important. Quadruple helix is important in innovation between government, between academics, within private sector, and also the industry, and also the civil society and the community. Regulation maturity is important. A lot of our regulation really needs to be looked at if we want to move forward. So with that, I thank you very much. I hope you have gained some knowledge from my presentation. Thank you again.
Thank you very much, Dr. Fazila, for such an interesting presentations. Post-COVID-19 pandemic, of course, require a transformative and comprehensive recovery plan, especially in the digital health era. So now we are moving forward to our next sessions. It's a Q&A sessions. A question can be asked in the chat menu in the Zoom or by raising a hand in the Zoom features.
Anyone has questions?
Yep. I think we are waiting for a bit, Doctor. 1 and 2 minutes to
Sure.
give the chance the audience to ask the questions.
Yeah.
Okay, seems that,
there's
yeah.
a question here. Yeah.
Yep.
What is the government policy to start up a wellness center in Malaysia? I think all the private centers are falls under Act 586, and there is so you can really look into it. It's on the website, all the requirement for a private center, but I'm not sure whether there are components of Act 586 that covers, I think, 8 or 9 type of centers. So I think you can, I don't have the details, but you can look at it as Act, what do you call it? Private Facility Act Services, Act 586. Yeah.
Okay, Doctor. Thank you very much for the
But
response.
just one question, but it may not address issues of technology and innovation in there. That one just in terms of requirement of the infrastructure, the governance, and so forth. But I think we must not forget to include the digital technology. You must not forget to include innovation, and the moving forward is digital transformation. So that must be included in all the wellness center and how the service is provided to the people.
Okay, thank you so much, Dr. Fazila. I think we still have time for another questions. Anyone?
Yes, Prof, you have anything to ask, Prof. Iko?
Yes. So
Yes, Prof.
thanks, Mr. Amir. Okay, I have one questions. Yeah, on the public-private partnerships. Yeah, on the implementation of digital health. Whether do you have any regulations or not related to that?
No. So far we don't really have a clear-cut policy, but we saw this a lot of public-private collaboration during the pandemic. So during the pandemic, it was everything was done very fast and with a lot of MOUs and MOAs and so forth. So I think moving forward, so pandemic has proven that it can be done. So I think moving forward, we really have to have clear policy in working together in collaboration. But there's also a lot of collaborative platform that we are working together with the industry and also the academics. So, for example, the iConnect platform, the NTIS, the National Technology Innovation Sandbox, and also under My Digital. Right now, we are working with other parties. So there are a lot of platforms that we can work together, which also includes the Private Healthcare Nexus platform, where there is a technology component in there.
Okay. Talking about the Privacy Act or the protection for the private data, how strict is Malaysia apply this act basically, or the rule to protect the privacy data?
A privacy of which data?
The health data. For example, we have the HIPAA in the US, and also the regulation for the private data in Europe and so on. And how is Malaysia?
We don't have very specific regulation for health. But all our regulation falls under whatever Privacy Act that's already available, like the PDPA. We also have the Code of Conduct and also the Act under all the councils, the Malaysian Medical Council, the Nursing Councils, and so forth. So under the individual act, there are clauses on privacy and confidentiality, but we don't have very specific like the HIPAA and the GDPRA. But a lot of our system vendors who especially vendors from international, they follow that regulation. So in that sense, we are also covered. But also we are also very strict about our privacy and confidentiality, and we also follow a lot of the act that is under MAMPU. So MAMPU is the ICT arm of the government. So they also have different level of privacy and confidentiality when it comes to sensitive data, health data, and so forth. So we just follow that, yeah.
Okay, my last question maybe, Doctor. Related to the Telemedicine Act, which is 1997. Okay, what do you think? This is still applicable for the today situation, or actually we need to change this act?
Oh, that's why if you see in my slide, which I had the digital ecosystem, the act is no more there. We have already requested the act to be repealed because it is taken over time. This, the act is no more relevant, and there are a lot of new ways of doing things. So that act is no more in place. So right now, it follows whatever existing act that is going on. But moving forward, we are also thinking whether we really need to come up with a new act, or we can just leverage on whatever act that is already out there. So it is still under discussion.
Okay, thanks, Dr. Fazila. I think there is also another question from Dr. Sri.
Yeah,
Amir?
Dr.
Yes.
Sri has asked whether this digital transformation are approved by MOH. Yes, definitely. I've already presented to you. It's also our digital strategic plan 2021-2025. So it's all been approved. Whatever I presented today has been approved. Yeah.
Do we have any other questions? We still have another few minutes. I think that's all of the. I think, yeah. Thank you very much, Dr. Fazila, for the first sessions. Before we start for our next speakers, I would like to kindly remind everyone to fill up your attendance by answering the survey through the link provided in the chat box, as participants are entitled to a certificate if the survey has been answered. Thank you. Can we move to our second speakers?
Yes, I think.
Yep. ID team. Seems our second speaker is not joined yet. I think we are.
Yeah, actually I'm here.
Oh, yeah, that. Oh, sorry,
I'm
that.
just waiting. I'm just waiting.
Oh,
yes.
Okay, share that.
So may I start?
With that. Okay. Now we are moving to our second speaker, Dr. Suhaini Kadiman. Dr. Suhaini Kadiman is a senior consultant, anesthesiologist, and head director of clinical research, Institut Jantung Negara, Malaysia. Dr. Suhaini received his Bachelor of Medical Sciences and Master of Medicine in Anesthesiology from University Kebangsaan Malaysia, and also fellowship training at Pepworth Hospital, Cambridge, United Kingdom. Dr. Suhaini mostly work on perioperative transesophageal echocardiography, neurocognitive functions, post-cardiac surgery, and clinical research. Dr. Suhaini will deliver a topic on the challenges and opportunities in healthcare center management during COVID-19 era. Similar to our previous speaker, Dato, you will be given 20-minute presentations and 10-minute Q&A. Dr. Suhaini, the floor is yours.
Assalamualaikum warahmatullahi wabarakatuh, and a very good morning, Mr. Moderator. First of all, let me share my slide. Can I have capability to share my slide? Do you have my slide now?
Yes, Dr. Yeah.
Okay, good. First of all, thank you very much to the organizing committee for inviting me and having me this morning. It is a great pleasure to be a part of the Management of Future Healthcare and Wellness Center webinar organized by the UTM and the ITTP COVID-19. The title of my presentation today is Challenges and Opportunities of Healthcare Center Management During COVID-19. The IJN is the premier cardiac center in Malaysia. We have the vision to be the global center of excellence in cardiovascular and thoracic care. This is supported by 5 main missions. And our mission number 1, we are committed to serve and provide our patients' need first with safest and highest quality of care. This is the mission that is severely affected and challenged during the COVID-19 pandemic. We have to do all our best to make sure that even in the era of pandemic COVID-19, we ensure highest quality and safest care to our patients. We were supported by 158 clinicians, and with this, we were trying our best to survive and to make sure that the services to the nation is uninterrupted. To understand this, let me share with you the short video. Please enjoy me please be with me to enjoy this video. So as the Premier Cardiac Center, definitely the challenges are many. And when we are facing for crisis, we have to refer back to the Guru, what the Guru says about preparing ourselves for the crisis. Number 1, we have to identify the risks and plan for the way to minimize those risks. Number 2, establish monitoring or early warning system so that we can be prepared. Number 3, we have to develop crisis response plan. And number 4, we have to identify someone to act as a crisis manager. Such a wide and big organization requires a streamline, and we have to make sure that the function is cross the functional structure of the organization. And when the crisis did facing us, we have to then execute the action plan, and communication is extremely important. So how do you identify the crisis? We see from various angles. From the angle of economy, the expert has mentioned that a pandemic COVID-19 has disrupted our GDP, has disrupted the services, has disrupted the manufacturing sector, has disrupted the agricultural sector, and has disrupted the construction sector. So we understood that this COVID-19 pandemic was pushing Malaysia into its first recession since the global financial crisis, and the Malaysia GDP was forecasted to be minus 1.7% in December 2020. So definitely our organization has a direct impact on this from this COVID-19 pandemic. There was also a severe disruption of the supply chain, and this was inevitable, and it also disrupts us as the service provider, because we rely hard for the supply chain to ensure our services is uninterrupted. And we also face the domino effect from other industry that was affected by the COVID-19 as well. When we look into the risk of the spread of the COVID-19 itself, we understood that this COVID-19 affected everyone, especially our own staff, who is the frontliner. And we as a hospital were at a higher risk. We also have customer that is exposed, and the customer were reluctant to come due to various reasons, due to number 1, the MCO, and number 2, the possibility of even outbreaks or clusters that can happen even within the hospital environment. When we look into the management of the movement control order, we have underwent various types of MCO, whereby each phase of the MCO has a different rules and regulation. Therefore, the situation is very dynamic. It affects the accessibility of our customer, our patients to the healthcare facility, such as IJN, and therefore IJN has to adopt an adaptation is required for the dynamic of the rules and regulation. We need to establish monitoring and early warning system so that it can give us notice if something high risk were to happen. We not only rely on the My Sejahtera, we also have to interacted with the facial recognition and the possibility of high risk that might happen in our own premise. In the event that outbreak happens, we can trace this one back so that we can control the outbreak soon as possible. When we develop the crisis management plan, there are 10 steps that we need to follow through, but I would like to highlight the two most important aspects of it. Number one is the leadership. The leadership has to provide a clear chain of command, and it has to come from a single command center so that the rest of the organization only follow one rule in the entire organization. Number two, communication is extremely important. Communication needs to be done not only internally, but communication has to also be communicated well externally with our stakeholders. And we have to empower and authorize the crisis management team to make key decisions during the pandemic. So what did we do in terms of response? We have 7 pillars that we adhere to. Number one, we stay close to our customers. We communicate well with our patients. The top management need to very well versed with the action plan, and all those action plan must demonstrate purpose to all our stakeholders. The top management need to go across the functional structure of the organization and have to be liquid enough to address the issue of change in terms of the factors affecting the pandemic. And we need to stabilize our supply chain. Therefore, our services will not be interrupted. So the task force ensures safety and ensuring the patient really understand that they only come to the hospital only when it is necessary. If the patient do need to come to our hospital, the SOP is being reviewed for scheduling, whether it is elective, urgent, or emergency. The SOP is also being reviewed for screening and diagnosing of COVID-19, and we also review the SOP for the management and procedures for our patient to ensure that the processes is shortened as short as possible. And to allow this, to align this, we have created one-stop center to make sure that everything is aligned to the objective of the organization. The task force also ensure the safety and quality of the performance of our staff. Internal communication and education is being done regularly to protect our staff from being affected by the COVID-19 and to prevent outbreak, because our staff have 2 categories. There are healthcare staff and non-healthcare staff. We need to then schedule them who is going to be standby at home, who work from home, and who has to come to the facility. For those who come to the facility, we have to make sure that the surveillance, screening, and diagnosing is being done regularly to prevent unwanted outbreak in the hospital. The task force also have to ensure the safety and quality of the environment to protect the environment from becoming an agent of outbreak. This also need to be done and coordinated well towards the entire facilities in IJN. We also empower the occupational safety and health infrastructure. We divided that into 2, safety and health. Each of those sections is being manned and lead by different officers so that the issue can be addressed quickly without much of an issue. Digital transformation definitely is important. We were lucky because we were into the transformation as early as 2017. So some of the features is already available for us to utilize to ensure that the management of the pandemic COVID-19 can be done as effective as possible, such as the online appointment, scheduling and rescheduling, teleconsultation, engagement between our clinician medicine home delivery to minimize picking up the medicine in our facility. And then to summarize what we have done, again, please join me enjoying this video. This is again another short video for you to view.
The sound is not yet shared, Doctor Dato'.
In today's Heart News, we will cover how IGN implements infection prevention and control measures for patients, visitors, and staff in the new normal. Since January this year, IGN has set up an in-house COVID task force in response to the COVID-19 outbreak. The team is responsible to plan infection control process flows, conduct routine assessments of risk of infection, and provide continuous education to patients and staff.
We got to the health centers. There's a fever, cough, have improved or increased the numbers of target for any doctor, as stop center or
Strict SOPs are in place for patients and staff to adhere to maintain physical distance, compulsory usage of face masks, and frequent sanitization of hands. As the number of patients begin to grow rapidly, IGN is now faced with a challenge to manage the crowd while ensuring their safety. As one of the solutions, IGN has started a free service, the medicine home delivery.
Medicine home delivery. We look at the outpatient consultation service, outpatient service. But patient has to become registered. We have a multiple short-term. Then patient has to wait for the doctors for consultation. Then after that, patient has to go to the pharmacy. In this process, all patients will that may require or some hello doctor service. All of it.
The new norms implemented reduces the waiting time and limits overcrowding at the hospital. This is one of the many ways IGN is ensuring the public health and the safety while meeting the needs of the people. Together, let's break this chain. I'm Mariam Azmi. Thank you.
So all those is being done to ensure that the workload of our organization is not affected dramatically due to the pandemic COVID-19. And as a result, Alhamdulillah, we thanks to all that has been given their full cooperation to ensure that our workload remains, even though it's not the same as the previous years, but at least it's not severely affected. So the clinical and outpatient patient workload is slightly reduced as compared to the 2019 and 2018. And similarly, the procedures and surgeries is not as bad as compared to the previous years, 2019 and 2018. And furthermore, even with the restriction and limitation during the pandemic COVID-19, we were still capable of achieving our milestone to deliver the state-of-the-art medicine, treatment, and care for our patient to serve the national need, even during the challenging time of COVID-19. So I hope I have shared some valuable experience that we have implemented during the COVID-19 for the rest to learn and to share as well. And hopefully this serve good for everybody. With this, I thank you, and I then take some question if there is any.
Okay. Thank you, Dr. Suhaini, for such an interesting presentations. As we know that during the COVID-19 outbreak, there are a lot of challenges faced by healthcare organizations or professionals. For example, insufficient of medical staff and equipment, but it also bringing the healthcare organizations, like particularly those that have entered the recovery and rebuilding states, the COVID-19 pandemic, as an opportunity to transform into more agile and resilient learning system. Now we are moving for Q&A sessions. As usual, questions can be asked in the chat menu in Zoom or by raising a hand. We have 10 minutes for this session. Oh, we have a question from Professor Professor Nino Mantri from UNER. How is the Malaysia do for the genomic surveillance of COVID-19, the WGS, and also the spread of COVID-19 variant? Thank you. Is respond that?
I think this question is not appropriate for me to answer because the genomic surveillance is being done by the government under the Ministry of Health. Maybe if Dr. Fazilah want to take the question.
Yes, actually genomic surveillance has been done from the beginning. So it's mainly done by IMR initially, but it's also done by some of the universities like University Malaya, UKM. And right now, I think there is a consortium of universities that's doing this genomic surveillance. But genomic surveillance, we also, if I'm not mistaken, we also publish to the International Genomic Surveillance Data Platform, I think. And we do for all cases, random sampling for all areas where there are clusters, where there are clusters, or travelers coming from overseas, or travelers coming from countries that has variants, VOCs and VOIs. So it is done, but hopefully it'll pick up more as more and more universities are coming to do the genomic surveillance. And the data is always published, I think monthly or weekly, in terms of what are the variants that is found in the country. Thank you.
Thank you, Dr. Suhaini, for the response, and also Dr. Fazilah for the response for the previous questions. Do we have any other questions from the floor? We have a question from Mr. Nabil. What is the considerations or parameter that have been used to decide the implementations of IR 4.0 in IGN? Please, Dr., you may respond to questions.
Yeah, the digital transformation is the organizational wide initiative. So we have, first of all, get the buy-in from all the stakeholders in the organization. The objective has to be set clear, okay? And the processes also have to be understood by all these stakeholders. Then we have to align the processes in this organization with the objective and with the digital transformation that we plan to do. The platform need to be understood by everybody so that when we execute the plan, we have the buy-in and cooperation from every single staff in our organization. So communication is extremely important. We need to address the issue of champion. Champion need to come from the ground floor. Although the initiative is the top-bottom, but the people that is going to implement this is from the ground floor, from the bottom part. They are the one that is going to, key in the data, open up the apps, make sure that the compliance is there. Without the ground people commitment and compliance, no digital transformation can be achieved or successful. Sometimes the mistake that we had or we do is we think that once the CEO wants digital transformation to be implemented, then the entire organization will then automatically move into digital transformation. No, that will not happen. It has to be embraced by every individual in the organization, and that therefore the change of the mindset is very important. The software and the hardware is easy. The software and the hardware is the least problematic in implementing the digital transformation. So why is this not being done 5 years ago? Because 5 years ago, probably the task force, the people in the organization doesn't see the need to transform into digital technology. It is an initiative that requires a lot of commitment. We are transforming the processes that we used to do manually into a digital process. It is something that requires a huge commitment in terms of understanding, in terms of time, energy, and thinking for us to embark into. Hopefully this answered the question.
Doctor, I have a question.
Yes, Dr. Fazila, can.
No, I like it when you said that software and hardware is not issue. It's really, I think software, hardware is not an issue. You have money, we can do it. But I think it's the people, So whenever people ask me, what is your one big issue? I will always say people.
Yes.
To get people to change is very difficult. But somehow I think in this pandemic, we are able to show that it can be done. Everything can be done very fast. So very excited to see IJHN has one response to say, stay close to patient or to customer. So that means you're not going to turn back. Moving forward, you are going to use digital transformation as the way to connect to your customers. Am I right?
Yes, definitely.
So does it mean you have to change some policies, some processes to adapt to it?
Yes, a lot of processes and policies have to be adopted to the digital healthcare system. Our EMR is going to go live 100% by April next year. So we are still in the transition period of time. And of course, change management is a major issue. We have conducted the change management as early as 2015. And every year we engage again with all the stakeholders in the organization. That is 2015 is easily 7 years before the actual date of go live. So that's how we prepare our people to make sure that everybody has buy-in into this program. It cannot be changed within 1 year. Definitely impossible. Yeah. We require multiple years to change the mindset and to manage resistance if there is any. Of course, there will be always certain quarter that is very resistant to change, and we need to engage them, understand why there is a resistance to change, and try to educate them and try to improve things if their concern is valid, and see whether we can move forward together, embrace them so that they can understand. Of course, we in the organization have various category of age. Okay. Some categories are above 60, some categories are between 40 to 60, some categories are young staff, which is early 20s or early 30s. So the adaptation to the digital transformation is different in terms of their behavior, and we need to address that accordingly.
Okay, thank you.
Thank you, Dr. Suhaini and Dr. Fazila. I think we have another question and will be our last question for this session. IT team, can you help to set the question? Okay. How is the digital implementation? How the digital implementation team in the IJHN structured? How many team members involved in their roles? Maybe you can use that for the response of the question.
Everybody is represented in the task force in what we call the the EMR initiative. Everybody is represented, from finance, human resource, facility, biomedical, clinician, non-clinician, nursing division. Everybody is represented. We need to have a buy-in from everybody. Even the security and our cook also is represented in the digital transformation. So they are all there. We are all come in as an organization for this digital transformation. And of course, the leader is very important. The champions on each particular segment is very important. There are our link person to the top, from the top management to the rest of the organization. And to structure this is extremely important. We do not want any quarter to be left behind, because one quarter left behind is a failure to the entire organization. This is very crucial. Thank you.
Okay, I think will be our last questions. Thank you, Dr. Suhaini, for this second sessions. Now we are moving to our next speakers. Miss Ani Savitri. Is Miss Ani already here?
Hello.
Okay. Okay, Miss Ani.
Okay, thank you very much.
I think before we start, I would like to introduce for a while. Miss Ani Savitri is the head of marketing of SPA Indonesia, Indonesia Spa Association, as well as founder of Andaru Anti-Aging Clinic and Spa Indonesia. She has finished her study from Indonesia School of Finance and Banking, Jakarta, major in finance, postgraduate diploma for internal audit from City University Business School, London, and CDESCO diploma in cosmetology and beauty therapist for international qualification Zurich. She is currently serving as a master assessor for National Professional Certification Agency and master examiners for SPA qualification for the Ministry of Education, Republik Indonesia. She also member of SPA Consortium for Ministry of Education, Republic of Indonesia. Ms. Ani will deliver a topic on the challenges and opportunities in the wellness center management during COVID-19 era. You will be given 20 minutes presentations and 10 minutes Q&A. To shorten the time, I would like to pass the session to Ms. Ani. Ms. Ani, the floor is yours.
Okay, thank you, moderator Pak Amir, for introducing me. Let me greet all the audience, the speaker today, Prof. Eko Supriyanto, and also Dr. Fazia Saik Alauddin, and Bapak Datuk Dr. Suhaini Kadiman. And good morning, all the family wellness here. And some of them I know already, they are from Indonesia. Good morning, everybody. Okay, let's continue. The COVID-19 pandemic is really influenced our customer, actually, psychological behavior for traveling to destination and having a spa treatment. In this case, the consequences of this pandemic could change many aspects of human life and business, especially in the spa business. The effect of COVID-19 has mentally effect, especially to those affected by the infection, losses, the friends and the family. But we are from the association and also the government keep on doing, find the best solution for our member in having a sustainability development approach to mitigate its negative impact. Okay, let's start the current condition. Next slide. We put this in the slide. We put this into 3 points of view from the customer side and the owner side and the professional side. We take a look from the customer side first. Our customers tend to stay at home right now, and they prefer to choose work from home, especially for elder people. They like to have a home spa treatment, beauty services at home, and also the demand for treatment at home is increasing. It shows that the evidence that more digital application for the spa and beauty is increasing as well. And then the next, when we are looking at the owner side, of course, they are struggle right now because actually until now, spa business cannot be operated in the Jakarta and some area of province, but some provinces already operated already. Like Bali, they start already. Since we have more than 1.5 years stop the business, and if they start again the new business, it's like we build a new investment, new working capitals. Yeah, this make consideration to the entrepreneur. Either they keep on the track in the spa business, or they choose different line of business. For example, culinary, training and education, home industry, or jamu and health food to be online health food. And the last, from the professional point of view, of course, is surviving for them, but they are keep waiting and enthusiastic to start the business, to start again to work. They are waiting for the entrepreneur open the spa, and some of them they are find other opportunities abroad, and some of them also developing the competency through the online training and education while the pandemic. And some of them work as a volunteer mentor in upgrading the spa of friends as spa therapists in their area, city and province. And interesting for them, they also make a jamu and selling online at home, and they're quite aware now that the expectation from the customer and also the owner is changing already. And the professional have to increase their competencies and follow the health protocol, even though it's hard for them, and wearing the mask in every work, and also a double sometimes with the face shield. That's the condition right now. And next slide. We are take a look from the crisis right now. It's not only for the tourism sector, the crisis coming in, but the airline, manufacturing, cosmetics, also furniture, car, and also property is going down now. And the crisis come, but always follow the opportunities. We take a look which business opportunities is grocery and healthcare, home entertainment, and then online marketing and digital platform increasing, selling basic needs, grocery online, medicine online, even a doctor consultation is online, and the online prescriptions as well. And then they give the drugstore, and then the medicines is coming at home. So that's mean that delivery services is increasing. Okay. And now, next slide, we take a look also from the spa and wellness center at the moment, and facing crisis and still got the opportunities. As I said, in this pandemic, customer life is changing, less customer come, having a treatment in the spa or the salon. However, spa entrepreneur more creative and innovative. They are providing new services. They build a spa in a natural concept with a spatial concept, spatial ambience to attract people coming. And then they put investment for the new equipment that combining with the traditional recipe. And this is make the less contacting between the therapies and also the customer, and more personalized program developing for the customers as well. And digital system is needed. and reserve from the reservation, financial transaction, and more focusing to maintain the customer loyalty actually. Using a digital system is to control and maintain also the loyalty of employment. Now is developing some of the application already developed for the loyalty for the employment, but it's not integrated already with the SPA system. And some of them also try to develop the line business like a training center for the spa and also for the beauty training beauty center as well. And that's the fact. Yeah. And then next slide. We take a look from the future wellness and collaboration, and we our customer behavior changing. They are seeking a destination place with the established infrastructure and handling the COVID-19. Some of them seeking a country with well-managed right COVID-19 protocols and seeking a spa with apply the COVID-19 protocols for protocols as per a government regulation right now. And product innovation using a spa and beauty equipment, less human interaction, and also develop the product aromatherapy for respiratory system and immune system. And also since the customer more health conscious, natural and organic product preferable and increasing right now. And also the now they are making a collaboration and cooperation. For example, like the company own property, join with the spa operator, digital operating system, the product supplies, join together and support each other. And also the activity, social responsibility for the community, help to help and develop the micro and also small enterprises. And then we might go to digital oriented right now. To make the operating system more simple, less interaction with people, practical and more user friendly for the customer, and easier to track the customer preference from the artificial intelligence, and time efficiently to respond to customers, or in other words, to increase our service level. In some digital application offer maintain the loyalty for human resource, as I told before. For example, like bonus, incentive system, wellness activities for the employees, training, development facilities, and also knowing what our employee needs and preference. Yeah, that's the digital things that might be applied in the new norm. And then if we take a look this slide from the government side, what they have done for us already in general, through Peduli Lindungi apps application, the government will be able to easily to detect the spread of COVID-19. The application continue to develop and improve its functionality. One of them to access the vaccine certificates, and then COVID test result, travel history, telemedicine and doctor, also healthcare facility and travel regulation update. And for the Ministry of Tourism and Creative Economy, Republic of Indonesia, facilitated both tourism professional and industry for a training and national competency certification. While the pandemic, they facilitated also developed the national qualification spa framework and facilitated for the national working standard for the spa and wellness beauty industry. And they helped to arrange the distribution of the presidential funding for the tourism micro and enterprises as well. And the last, the National Standardization Agency, or we call it the DSM, is a non-ministerial government agency actually, tasked with fostering, developing, and coordinating activity in the field of standardization nationally. The DSN composes the national standard of cleanliness, health, safety, and environment well-being to tourism sector for a year 2021. Works with the two kementerian, or Ministry of Tourism and Ministry of Health. And this will conduct all steps, all the business process from the receiving the customer arrival till the end of the treatment. For example, they give the protocol of how to wash hand and keep the area is clean and sanitized, and then provide instead of the shake hands something, to change our traditional body language greeting with the both your hand put in front of the chest, and then greetings as like an SOP. Yeah, using personal protections as well, with for professional and also the customer, and then wearing masks, and then wash hand, and then keep physical distancing, and then regular sanitation for the room and equipment as well. And then also self-assessment form we should provide for the customer, and also professional regularly, and more efficient using the water, electricity, and use the dry toilet is preferable, I think. That's what's the government doing for us. And the next slide would be our simple business process. If we take a look from the business process, this is the actually is more suitable for the spa. This is not for the wellness, but it's quite similar, the business. We start from the in the middle is processing the reservation, and then also we have the blocking room. We need to blocking room, and then also receiving the guests, consultation, having a treatment, billing, and then guest comment, and also offering after they finish the treatment, we offering a product or other services after that. And also the customer relation management, all together in the middle. We can also provide the digital things to manage the operation more efficiently. And then after that, after operation, from the higher management side, they can evaluating, and then also keep the quality assurance for the operation. And also after that, after the result, then they can also make a new plan or new investment, some of them new investment, and then research for them. And then this is like a cycle of business in the spa, and to have sustainable development of the spa industry itself. And of course, with the green line, the new norm protocol, we should apply in every step of the treatment, or every step of the SOP in the operation spa. I think that's all from us, from Indonesia. I hope it will give you more information and about the progress of the treatment about the spa and the wellness in the future. Thank you.
Thank you, Ms. Ani, for the presentations. Now we understand the conditions of the wellness center before the outbreak of the COVID-19 and during these current situations. I believe that the Indonesian government, without exceptions, other government from other country has issued various policies to fight the coronavirus diseases. Now we are open for a Q&A sessions. As usual, questions can be asked in the chat menu or by raising a hand through the Zoom features. Is there any question from the floor? Yeah, I think we have a questions. IT team, can you help us to set the question so that everyone and
Yes.
even the speakers?
Sorry, I have a
Oh,
question.
sorry. Yep, Doctor. Yeah, please, Doctor.
Yes, apa kabar Ibu Ani?
Baik, Dr. Fasya.
Yeah, I want to ask, is SPA and does it fall under a different act under the either it is a traditional and complementary medicine or it is considered as a health facility?
Actually, for the spa, still in the complementary, traditional and complementary health. So the clinic is different. The clinic is for the medicals and everything, but some in terms of the development of the business, some of the entrepreneur wants to open a spa like a medical spa, so they can combine with
Okay.
the traditional and also medical things. I think like that.
I see. Okay. So
Yeah.
during the COVID, was it very difficult because all our traditional and complementary medicine had very difficult time during the COVID because of the strict operating procedures?
Yeah, of course, because the government doesn't allow us to operate even the
Yeah.
spa, even using the traditional things, because we actually are much more interactive and close with the customer.
Yes.
So they tend to protect us to give a standard first and make a standard more established first before we start the business actually.
Okay. All right.
But for the salon, actually it's open already since 2020. Yeah, because salon beauty center, not beauty center, but limited to the salon services. I mean the hair services.
Yeah. Yeah. So it's same here, the same problem we're having in Malaysia.
Yeah.
Thank you.
Yeah. Thank you, Dr. Faisal. Any other question?
Yeah, thank you, Dr. Fazila, for the question and answer. We have a question from Professor Amarila from Universitas Indonesia. Does the business profit linear with the transformations of opportunities after the pandemic crisis? How much the new norm health protocol burden the business? Please, Ms. Ani, to respond to questions.
Yeah, actually, when if we take a look, the business actually is going down right now. Yeah, but we are also quite confident that people try now to try to build the confidence to come to our spa if if they believe that we operate in the proper way with the standard of that the government's already given to us. So this is make everybody lost confidence. The customer lost confidence. The also the entrepreneur loss of confidence. But we actually this is a start. We have to start next year and become very big. And the protocol, I think, because the government built the protocol, contributing with the association also and the professional and also the industry coming in. So this protocol, I think, is suitable, and they are happy with the protocol that we set up already right now. I think that's good things from the government. Quite hear the opinion from the stakeholder.
Thank you, Ms. Ani, for the response of the question. I think we have another question. I think will be our last questions. IT team. Yes, I think from Dr. Sujanti. I'm sorry if I pronounce not correct. Thank you, Ms. Safiti, for the great in Indonesia Wellness Center or anti-aging clinic falls under which ministry? I think it's such a short question.
Or which ministry?
Yeah.
So the spa actually under the Ministry of Tourism, but only for the business, the industry itself, but the standard of services still under the Ministry of Health. And then this for the anti-aging, the same thing. The business still under the tourism, and also the standard of services under the Ministry of Health. So that we make we divide it into two different issues in this case.
Okay.
So if we talking about the developing of the industry, and then the human resource regarding of the standardization, we talk about we are on the based on the Ministry Ministry of Tourism, and starting with the all the services and the standard of the health and requirement and protocol, especially for the protocol. COVID-19 is under the Ministry of Health. I think that's the condition.
Okay, thank you, Ms. Ani, for responding from our last questions. Thank you also for the session. Now we are moved to our next speakers. But before we start, I would like to kindly remind everyone to fill up your attendance by answering the survey through the link provided in the chat box. Well, now we are moving to our last speaker, Professor Dr. Iko Supriyanto. Professor Iko is a professor in Advanced Diagnostics and Progressive Healthcare Research Group from University Technology Malaysia. Professor Iko received his master in biomedical engineering from Institut Teknologi Bandung, Indonesia, and PhD in medical electronics from University Federal Forces, Hamburg, Germany. He has an experience in smart clinics development, health risk calculation, healthcare management, and medical robotics. Now I would like to invite Professor Dr. Iko Supriyanto to deliver the topic incorporating technology IR 4.0 in the management of future healthcare and wellness center. Without any further ado, Professor Iko, the time is yours.
Okay, thanks. Okay, Mr. Amir, can you listen me? I mean, hear me?
Yes, Prof, it's quite clear.
Okay, let me share my screen. Before I share my screen, okay, how long the time given to me?
I think you have 30 minutes, Prof.
All right. Yeah, I try to make it. So, very good morning, everyone, and okay, assalamualaikum warahmatullahi wabarakatuh. So I hope that everyone having a very good health, okay, today, and then okay, still able to stay until okay end of the sessions. So it's okay quite technical, but I will try to share with okay very easy language. So the committee gives me a title on the how to incorporate the IR 4.0 technologies in the management of future healthcare and okay wellness center. This is my outline. Actually, okay, first I will okay try to introduce the problem background and also the objective of my talk, and also okay generally of this okay webinar or course. And then second, okay, we will also present our app survey, yeah, related to the health and wellness. The next will be okay. I will try okay to discuss the challenges and also opportunities. Then okay, the next one, yeah, someone that might be okay not really familiar with IR 4.0. Okay, you can also follow my talk. And then okay, still, yeah, I think okay, Datuk Suhaini, Dr. Fazila, and also okay, Miss Ani mentions okay. The change is very important. It's not only the technology, but the okay required support, including the okay culture changes and also the regulations is needed. And then okay, I will give you an application example that okay from our team, and then in the end I will conclude okay my presentations. So talking about the statistics, yeah, if we see here, I just took from this source Statista, yeah, from 2017 and then 2021, and then our team is calculated and then try to project for the next 5 years basically. Yeah, we have 2017 to 2021, and then starting next year until 2026. So if we see here the percentage of telemedicine user of a populations, yeah, is still very less basically. It's just less than 1% in 2017, and then even in this COVID pandemic era, I think it's not really increased a lot. Even increase like more than 30 or 40%, yeah, in average, but it's still like 2%, and this also will slowly grow until maybe in 2026 Indonesia will have 5.38%, and then Thailand will have 4.97%, and Malaysia will have 3.454%. So it means this is problem that why it's not really utilized yet. And then the other things is on the digital wellness and also digital health. If we see here, in 2021, I took here 5 countries, include number 1 is Singapore here, the top one. And then the bottom one is here the Vietnam, and then we have the Indonesia, we have the Thailand, and then we have Malaysia. So the digital health include also e-health, wearable health, and so on. So if we see here, in clear in Singapore is almost 50%, but then we'll saturate in this value. Malaysia is already 35%, increase a little bit for the next few years. And then growing is another 3 countries here, Indonesia, and then Thailand, and Vietnam. Indonesia currently is 18, and then we're going to the almost 24%. So this is the digital health. And then if we see the digital wellness, this is also cover the spa, for example. Yeah, the trend is quite similar here. Number 1 is Singapore, the highest penetration rate. And then followed by the Malaysia 18%, and then I think there is a little bit difference. I was surprised because Indonesia is higher than Thailand in terms of digital wellness penetration rate, and then also Vietnam. But this number we consider still less by this year compare I mean the digital wellness still less compared to the digital health penetration rate, and this number actually will increase. And then if we see here in the end by 2025, the trend is for example here in Singapore, I think the digital health penetration is less than digital wellness. It means the number will change. So I think this is something that also interesting. So I think this is also the problem that still we need to do something to follow this graph basically. And then the next problem will be the impact of COVID-19 to the wellness center. So in this case is fitness and spa center. I just took also from some news and also from the internet. So here during the COVID-19 pandemics, activity level is really less. 50% less active, 31% about the same, and then 19% is more active. But here my point is 50% less active. So I think this is something that is not really good for our lifestyle basically. So and then the other thing is on the spa. Here there is decreasing in terms of revenue. Even in many countries, also like Indonesia, spa in the at the time can be considered is almost totally stopped. I think this is something that we can consider. So, however, this is also good for the digital point of view. Since because of this impact, then people really having higher awareness to use the digital technology or health apps in this case, to do fitness. For example, here some news mentioned that majority 90% of the health enthusiasts are familiar with one or more fitness apps. So I think this is from the survey. And then interestingly, for example, yoga is trending among women on the fitness apps. So and then men is toward to the weight training, for example, 65%. So and then there is a lot of apps in the area of yoga, fitness, and then weight training and so on. So and then also there is some survey that mentions that more than 52% of the fitness apps users plan to continue leveraging digital fitness services even after lockdown. So that we need to consider how then we are going to next because then challenge for fitness center, spa center to use this digital technology. And then if I'm looking, I look into the primary care and then dental clinic. If we see here, I just go for the dental clinic first. Yeah. So for example here, that 81% dentists agree that the income lower. It means here we can see that the visit to the dental clinic is tremendously reduced a lot. So I think this is a message that we can get it. And then from the primary care, here if we see the visits to the percentage of visits to the clinic is also reduced, especially for the periodic health exam. It's reduced to reduced minus 89%, means 89% lower than before. And then also common cold. It means these people that normally going to the health exam is not doing, and then the common cold just stay at home basically because worry of COVID. So, but there is also something that COVID is definitely increased a lot. But anxiety, anxiety I think is increased 34%. I think one of them is because the COVID make people stressed, depressed, and so on, and then the number which is increasing. So I think this is the number, but from this number, if we distribute it into a group, in terms of mental health, there is increasing number or just maintain as in pre-pandemic, and then that almost very far or very high decreasing is the periodic health exam, as mentioned before, 86%. But other thing is like well, baby care, immunization, and then common cold, something that's reduced. And then other diseases like chronic disease management, hypertension, diabetics is also decreasing. So so if I see why the mental health is increasing, here we can see also they involve the virtual visit. It means this is not really visit, this is meeting in the clinic, but because they involve the virtual care. If we see here, anxiety is 90% involving the virtual clinic, depression, common cold, and so on. It means people if having problem here, they will change to use the virtual care. And here that not use the virtual care, for example, periodic health exam, then it's clear. Because they're not using the virtual care, then the number of visits or the number of check is reduced lots basically. So I think this is also the message that we can get from the impact of the COVID-19 to healthcare center, especially here primary care and dental clinic. So basically, objective of my talk here is try to discuss the challenges and the strategy to utilize utilizing the technology IR 4.0 in health and wellness industry. Since globally, this both industry will increase. For example, here projected global digital health market from 2019 to 2025. I think the CAGR is more than 20%. Basically, So okay, up to okay 657 billion US dollar. And then if we see also here 2018, but also okay increase yearly. If we see here the personal care, beauty, and anti-aging is okay like okay around okay 1 trillion okay US dollar, and total for the wellness industry is 4.5 okay trillion okay US dollar. This is also something that is important. So okay, based on this, we did some survey on the health and wellness apps. How far they are? Actually, if we see from the Statista, okay, what are the most country use the health apps in the 12 months? China, India, Indonesia, United States, UK, Spain, Germany, and Japan. So in our regions here, Indonesia one of the top 3 basically. So and then if we see here the most and least used health and wellness apps, I just check Malaysia for example here. COVID-19, because I think we understand that the MySejahtera is used lots compared to other country in Southeast Asia, so 78%. So and then the next one, the sport and fitness activity tracking and diet and nutrition. This is for the wellness. So and then if we see in the bottom 3 here is the medical advice, meditation, and pregnancy. So I think this is also reflect to the statistic before. And then in Thailand is top 2 is same with the Malaysia, but also same with the Indonesia. So and then the Thailand stress and reduction and relax become the top 3. It means during that time the industry is really suffer, so that people maybe need to use this for the stress reduction and relax. But Indonesia diet, nutrition, sport, and then the number 3 is the COVID. Because at that time I think the Peduli Lindungi is not really distributed and then spread across the country. So then the trend for the bottom one is different, but pregnancy will be the same thing. So I think this is for our understanding. So basically if we categorize the health and wellness app, we can consider the apps is including the wellness and prevention. This is that considering the wellness, starting from the diet, lifestyle, stress management, alcohol moderation, and so on. And then for the patient experience tool, from the general healthcare information, symptom checking, include for example the COVID-19 temperature checking, for example. So and then related to the finding clinicians. So then we have tool for the diagnosis. This is that I think currently there are a lot of artificial intelligence that use this the technology for the diagnosis, and then condition monitoring, and the end the treatment. So include the robotic system included here also. So if we see the wellness apps in Indonesia, just I check from what website, which is they mentioned about the store rank. It means here Vita Sehat Makin Nikmat, and then sick pack in 30 days, and then home workout, lose weight, and then muscle. It means a lot of ads that relate to the fitness basically. And then if you see in the Malaysia, I think it's the same also. Fitness and also nutrition management, and then lose weight for women, something that they see and also they download basically. So this is the progress in the wellness. So for the wellness, I think there is also a lot of website that offer the situation. I just take here some wellness related to website or application in Malaysia like Indospa, Sentuh My, and then in Indonesia MyFaith, and then Kuwabi, Spotify, Singapore, and so on. And also in the clinic, I think you can check also very famous Smart Clinic, and then we have from Singapore Plateau Medical, WebMap, eClinics, and on Indonesia we have Halodoc, and so on. So if we see the adoption of this digital service before and during the or after the pandemic, I mean after the COVID-19 come to us, so the telehealth is maintained the highest still, because before I think telehealth is already encouraged to be used, and then telehealth is more and more. And then one that before here we don't have the health information technology. It means they use the health information technology for the IT basically for the hospital management is increasing here. So and then the next one, the connected healthcare service reduce basically, and then we have some mobile health increase, decrease a bit, but still maintain in the third place, and so on. And we have also IoT, big data analytics happen in this era. So and then if we see the challenges and opportunities, why people is not downloading the COVID-19 apps. Just try to summarize at the end. Here basically the issue of the privacy. If we see here, concern about the misuse of information collected, private informations, and then they worry also about the GPS location history. And then they mention also about the violated the human right. For example, if we see here, Indonesia is very worried, 51.1%. So on the misuse of the informations. And then Malaysia is also worry about the misuse, and Thailand, Korea, and Japan. So this is also surprised me, because normally the developed countries worry with the misuse of information, but not really here. If we see here, but change, Indonesia is the worriest countries in terms of misuse of information collected. So and then also fear of the private data. If you see here, Thailand is really fear on the private data information maybe go to public. Maybe there are lot of secret on that. So and then going to Japan, and then Malaysia, Indonesia, and Korea. And then the locations, the Japanese is worry with the locations, if they want to share, and then Korea, and then Thailand, Malaysia, and Indonesia. So I think this is something that a reason why they are not downloading the COVID-19 apps. So then from a study from the best rates apps downloaded from iTunes and Google Play resulted that there is some current limitation of the current apps. Even this is the best rate apps. Which is the questioning on the safety and effectiveness. They're questioning on the bias basically, because they develop for certain country that may not applicable for other country. They bias on the age, gender, socioeconomic status, personality type, and so on, and also social networking, and lack of evidence base. And then the other thing is on the requirement is always I mean here there is some sensor that need to be used, and then other problem also in terms of interoperability. So this is that related to the culture later. We'll explain in the next point. So we have the behavior change techniques also lacking from the current apps. And still, user friendliness, something that their questions. So this is some challenge from the best rates apps that we need to see. So from here we have also some survey results. The use of health apps in primary care. Result from the survey among the general practitioners in Germany. For example, they consider that health apps mean more work rather than less work for physicians. So there is additional responsibility that they don't want to have. That's why if apps is more work, then they don't want to use it. And then too complicated for many patients to use. It's a lot of menu, a lot of information, and then they don't know how to go. So data privacy is one of, and then also too time consuming. This is also related to the more work, so that the time consumes. So even there are also something that is very good here, but I just see the challenges here. Since the pandemic, actually, the usage of the telehealth is really lots basically. if we compare before and after pandemic, during the pandemic, they increased like almost 70%, but in the end, in average is 38%. If we see here, and then this will maintain according to the McKinsey survey. So and then here there are some suggestions to optimize the health apps in primary care. For example, here we need to have the legal definition on the quality criteria. We need to really have the data, privacy standard. We need to provide certification before reach to the market. They need to be audited by the regulatory authority and so on. So and then in terms of people, they need to have also people to be trained before and then to understand this technology and so on. So this is approach to optimizing the health app integrations. And COVID-19, I think as I mentioned before, in terms of consumer point of view, the use of the telehealth is increased from 11 to 76%. So and then the provider also need to use this. And then in terms of regulatory, because of this condition, there are a lot of new services come from the government basically. So I think this is also opportunities due to the COVID-19 that make the driving for the usage of technology IR 4.0. So if I can summarize the challenge of the mobile apps or the current mobile apps is first is the privacy. We need to see this one, and then safety, whether it is really safe or not, and then effectiveness, really effective or not, and then interoperability, security, user friendly, time consuming, and then also the utilization in the new norm or new normal. So I think this is something that we need to take consider in the development or in the improvement or in the the next mobile apps for anyone. So now the question whether IR 4.0 is a solution. So privacy, talking about the privacy first, we need to have regulations to give some punishment or fine if someone break the privacy rule basically. But important also cybersecurity. Even we have the regulation, we implement it well, but if someone still, there is problem also with the privacy. So it means the IR 4.0 cybersecurity is one of them basically. And then safety. One of the safety issue is because it's not monitored, not identified, and also in the end, if there is something related with the safety conditions, then we can control. This way, the utilization of the sensor and IoT is very important to increase the safety in health and wellness. For example, using the QR code, using the wearable device, RFID, and so on is one of to improve the safety. This is also a part of the IR 4.0. And then effectiveness. For the effectiveness, there are a few ways to do. For example, we need to apply the behavior change techniques. Because as mentioned before, if there is technology is very good, but the culture not changed, then it's just it's not really have big impact. Then artificial intelligence is also one of the way to improve the effectiveness and also the big data. We have more data, it means also more accurate diagnosis, for example, then it's more effective. So then interoperability. This is cloud server is enabling the interoperability compared to 20, 30 years ago, which is still where we don't have it. So no, I think it's easy to exchange the data. Only then the problem will be the protocol. But good. Currently we have also, for example, blockchains that enable the integration between like the cloud server and then the cybersecurity and also the state protocol, including the SL7. And then the security, cybersecurity is one of them. User friendly, I think what is going to the virtuality, augmented reality. This is also to improve or to increase the user experience or user friendliness. Time consuming, how our app is no need to enter something, no need to input. so that okay, it's not time consuming for the medical doctor or for the staff in the wellness center or the clinic. Okay, one of them is to use the sensor, IoT, cloud database, robot, so that the input can be okay done automatically. Yeah, part of them basically. So this is also part of the IR 4.0 technology. And then new norm is clear. In order to implement this, we need to implement like say, temperature sensor, connect to Wi-Fi, and so on. And then we have the okay mobile apps, for example. So this is okay the solutions. So if we summarize, basically the IR 4.0 technology having functions to collect the data, to process the data, and then also to visualize and act the data okay for the people. This is the sensor and IoT that we have, for example, starting from even QR code is also one of the type of the sensor. And then okay, PLE or the blue tooth energy, I mean the low level energy, and then some sensor there. Wearable device is also part of the technology 4.0 that currently a lot, and then also cheap. Only we need to okay understand okay the accuracy and so on. And blockchain, as we mentioned, okay, blockchain is one of the technology. Okay, this enable the data privacy, and also will enable the interoperability. The mix between interoperability and also data privacy will be managed by okay this technology blockchain. For example, in collaborate with the SL7. Cybersecurity, a lot of standard okay working on that. One of them is IS 27000 that manages okay the information security in the very holistic okay approach from the policy, and then human resource access control, and also encryptions, and then how to ensure the physical and environmental, and then also the communication security, operational security, until compliance and business continuity. So this is very comprehensive. We apply this, then we have very good actually cybersecurity system. Artificial intelligence is more and more, and I think okay world is very fast going to utilize okay this starting from the traditional technique up to the advanced techniques that currently we have the reinforcement learning. This is okay now going to the artificial code intelligence, for example, one of the research that currently still on. So for the IR 4.0 technology, we have the for example here for the mental health care, they have okay well established AI for this. And then for the wellness, for example, for the diet management, and then for the physiotherapy, to for example, make the posture okay better, and also okay for the primary health care, or in the early beginning of the okay diagnosis or detection, we can use the Papillon. So and then the next technology, the augmented reality, also use okay both for the health and also for the wellness, and robotics also used for the medical and also okay for the wellness. So now okay this is the technology that okay applicable, but what are the required support? So we need to consider the regulation, the change management, and implementation of the okay new normal. The regulation okay from the ASEAN, we have the ASEAN Digital Master Plan. We have also okay just starting last year, we have the global strategy on digital health from WHO. And then from the standard, we have ICD-10, HISL7, FIR, HIPAA, GDPR, and so on. And then okay for the okay security, we have the from European Union that we can follow. For example, security for the smart health services and infrastructure. And okay WHO this year just okay start to okay, already issue the ethics and governance of AI for health, for example. So this is okay the first support regulation standard that we need to follow. And then okay for the behavior change techniques, okay, we need to consider, if we have apps, we need to consider the individual dimension, social dimension, and then okay app designs. So here, for example, for the individual factors, we need to consider demographic characteristic, age, gender, education level, income, insurance, region, ethnic, and health conditions, and also motivations. This is the individual. And then for the social factor, we need to consider the social network, and also the source credibility, the publicity, recommendation of professional support from healthcare organization, and then legal supervisions. So this is, and also for the app design, we need to consider the functionality, the quality of info, core function, personalization, game-based, and then the perceived ease of use, UI design, efficiency, and then perceived usefulness, security and privacy, and also not forget the cost. I think this is something that we need to consider in the development of the mobile apps. Okay, from there, if we apply to give the score for the existing apps in the iTunes and Google Play, I think it's very less here, having 7 and above. Only 8 here, for example, the Google Play, the GPS track run walk that have the comply the BCT with the number of 8. So this is already we choose the best app is having even still problem. It means from here we can consider that the app is not really used by many people because they have problem with the behavior change technique. So and then the interest of new normal, for example, in Malaysia we have MySejahtera, Indonesia we have the Peduli Lindungi, and also we can also combine with other private mobile apps. So this is one example that our group developed. We call the iCare. This is intelligent clinical assessment, rehab, and enrichment. This is used for medical center, rehab center, and wellness center. The vision of this app is when everyone say I care, my life. So basically, there are 2 missions: to support the medical center, rehab center, and wellness center, and to support individual in maintaining the health and well-being. So actually, we try to apply the IR 4.0 technology in iCare. We connected with the temperature, QR code, PLE, and Wi-Fi. And then, we use the blockchains, for personal and health record. We apply ENISA and ISO 27000. We use the high performance cloud server. And then we use the artificial intelligence to calculate some health risks. And then we have the big data analytics, to calculate the customer satisfaction and also finance and then process business and so on, and also personalized care. And then we use the mobile app, but also we use the website in the automatic and manual mode. The manual mode actually is the old mode, which is complicated, but the automatic is really easy to be used, for example, so that the inputting into the system is very easy. So I think this is how we use this app in the new norm, where the apps is connected to the SaaS device basically for the temperature and also the hand sanitizer to be used in the new norm. So and then connected with the cloud or Wi-Fi and then temperature and alarm functions and so on. So this is the application for this device, and then application will be for the healthcare center, wellness center, and rehab center. This is for example for the if you see here the dashboard for the staff. We have waiting list. We have the completed. For example, this is for the either doctor or for the therapist in the wellness center. They understand. He or she has one person in front of that not yet treat. And then they completed that day 5, for example, and then they have 10 new booking. This is something that maybe interesting for the staff having this app. They can associate the statistic in the health. Finance and also achievement. So and this check in and check out during if they have the patient and also customer. So and then they have a QR code one of them to verify, and also for the temperature sensor, and then the apps connected also to the risk calculations of the COVID, for example. But this is not yet integrated with the MySejahtera or Peduli Lindungi. Hopefully for the future can be integrated. So this is for the customer point of view. They have some service available. They can choose the center, but center for the future we need to consider also the risk related to the COVID, for example. So they have the mode of the appointment, payment, and so on. Same also with the staff. Customers will need to be scanned when inputting, and then in the manager they can also see the occupancy rate. It means we need to ensure that the number of the people is not too much, and then the customer and then sales can see, and then staff analysis, the productivity, and so on. So this is the hardware that we have. Just scan, connected, and so on. And then we hope that we try to prepare, okay, for API so that we can transfer from one app to the, okay, national recognized apps, for example. So yeah, this is just for wellness center, for example. This is the website. You can also visit this website, iCare. So now I just try to conclude, yeah, my presentations. First, I think we understand that IR 4.0 technology is an important part of the future healthcare and wellness industry. I think it's very clear. Digital health having, okay, a lot of, okay, yeah, functions in the healthcare and wellness industry. And then, okay, the next one, the technology, or this technology, IR 4.0, has been developed. Actually, it's there already, okay, to solve issue related to the digital health and wellness. We have highlight issues starting from the privacy, safety, interoperability until, okay, the new norm implementations. But okay, still we need to consider in order to support the implementation of IR 4.0 technology, yeah, government regulation and standard as well as digital change management. Yeah, this is about the culture shall be incorporated. So okay, yeah, I hope this not take your time lots. Okay, thank you for your attentions, and then please welcome for any questions. Assalamualaikum warahmatullahi wabarakatuh, and okay, good morning.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Professor Eko, for the presentations. Similar to the presentation from Dr. Fazila Alia this morning, due to COVID-19 outbreak, the healthcare industry require a transformative and comprehensive recovery plan for future healthcare. I believe healthcare will be centered on the patient empowered to prevent diseases rather than just seek for a treatment only. There will be less emphasis on the treatment and care and more on prevention, diagnostics, and digital solutions such as mobile apps, smart monitoring devices, and artificial intelligence. Now we are open for the Q&A sessions. As usual, Q&A can be asked in the chat menu in the Zoom or by raising a hand. Is any question from the floor? We still have 10 minutes for the Q&A sessions. Anyone?
Yeah, I think hopefully, okay, what I deliver is already very clear. Yeah, the message that I deliver. Yeah, if basically I just, okay, want to like yeah, give some message that, okay, if someone would like to develop or want to, okay, use apps, I think we are free, I mean, to discuss on that, so that, okay, we can have something that is also economically or cost effective also for the center, but also not really against the privacy and also maintain or ensuring the security of the usage of the, okay, mobile apps and other yeah, website or other technology based on the technology 4.0 basically. So I think this is the small message that I want to give to, okay, all the participants here. Okay, please, okay, welcome. So I think so, Mr. Amir. If no other question, I think yeah, we can also close the session.
Okay. Seems the Q&A session. Sorry. Wait, Prof. We have a question, Prof, from the floor. IT team, can you help to share the screens so that Professor Eko will see the questions? I think I will read the question instead, Prof. Yeah. With all the complicated requirement in the implementations of the mobile application, what is the first step should be taken by the institutions to get started, Prof?
Yeah, I think for the institution, yeah, for example, the clinic or the center, yeah, before choose the mobile apps, they need to use the behavior change techniques, yeah, BCT, yeah, to analyze the mobile app that they want to use. They need to consider the privacy, they need to consider the security, and they need to consider also the effectiveness and so on. Okay, I think I already highlight in the previous slide. I think this is first that they need to do. Okay, because at the end, if they use and then they already I mean the patient already use, this to change is quite difficult. That's why better from the beginning really need to see this. After that they can choose this is first, but then also need to consider the cost. I think in the visitors one of them is cost effectiveness in the end, and cost benefit, whether if they use this will give benefit to the center or not. If yes, then I think is no problem to use this for the sustaining the wellness and also the health center. So I think this is the first and also second step to use the mobile app in the health and wellness industry.
Okay, thank you, Prof, for the response. I think we still have a time for other speakers or participants in the floor. If there is other questions or some discussions related to this topic, maybe we can turn on the microphone. So maybe we can discuss together. We still have 10 minutes. Yeah, we still have 10 minutes to discuss.
Prof, sorry, Prof, I have to leave. I have another meeting.
Okay.
So thank you very much for inviting.
Thank you, Dr.
Thank you,
Fazila, for
Dr.
the. But can wait for a while, Doctor, because this is the last session. We're going to take a photo session.
I think Amir, we can have
Okay. Yeah. Now we are move to next session, photo sessions. Before we end our session, I would like to request a group photo session with our invited speakers. Audiences, please switch on your camera. Please also install the virtual background set by the committee in the chat box. IT team, please help. I think we still haven't seen. Is this enough, everyone? I think I will start the count now, but I still see a few of the participants have not turned on the camera. Okay, I think IT team, please help us to screenshot this slide. I will count. 1, 2, 3. Hold for a few seconds. Another one for the best luck. 1, 2, 3. Okay. Okay, thank you, everyone.
Okay, thank you, Amir. Thanks, Dr. Fazila. Thanks, Dr. Swaini. Thanks, Ani.
Bye.
Okay, here we have Pak Edi. Thanks, Pak Edi. Prof. Amarila, hello.
Can we move to the next slide, please? Operator. Ladies and gentlemen, that's all of our agenda for today. Before I close this session, I would like to inform you to reach us through the website. There will be an upcoming webinar and other updates related to the ITTP COVID-19 activities. Once again, thank you very much, ladies and gentlemen. We hope to see you in other ITTP COVID-19 activities. See you and until next time. Goodbye.
Terima kasih, Pak Edi.
Thank you, Pak Adi, Datuk, Suhaini, Miss Annie.
Hello, Dr. Kim. How are you? Welcome.
you.